Ladies and gentlemen, thank you for joining us for the webinar installment for Working Hours Sleep and Fatigue and Investigating Human Fatigue Factors. I'd like to welcome today's moderator, Dr. Imelda Wong, to kick us off.
Good afternoon, everyone. Thank you for joining us on our second webinar in this series. I'm Dr. Imelda Wong, and along with Dr. Naomi Swanson, it is our pleasure to serve as moderators for today's webinar. On behalf of the NIOSH Working Hours and Fatigue Work Group, we are pleased to have you join us today with our featured speaker, Dr. Jana Price. Dr. Price has worked at the National Transportation Safety Board since 2001, where she began as a transportation research analyst, designing and conducting safety studies. Currently, she is the chief of the NTSB Highway Report Development Division and a subject matter expert in human fatigue. She has developed a methodology for documenting operator fatigue in transportation accidents and co-developed an NTSB Training Center course on investigating fatigue factors. For more information about this presentation and this webinar series, please visit the NIOSH Work Schedules webpage. Thank you again for your participation today, and now I'll turn it over to our featured presenter, Dr. Price.
Thank you very much, Imelda. I'd like to thank you and NIOSH for inviting me to give this webinar today. I am a huge fan of NIOSH. I think that NIOSH and the National Transportation Safety Board have very parallel missions, and I've really enjoyed and relied upon a lot of the work that you all have done to inform some of the work we do here at NTSB. So I'm happy today to be able to join you and share what I know about investigating human fatigue factors in transportation accidents or crashes, as I refer to them kind of interchangeably. As Imelda mentioned, I've had a pretty long history of doing this. I've been at the NTSB for about 17 years, and before that, my PhD work was in fatigue-related factors, and I looked at drowsy truck driver issues for my dissertation research, and pretty much have worked on that area the whole entire time I've been at the board, both as a researcher, an investigator, and an advocate in this area. So really glad to be able to share my knowledge in this area for anyone who is interested. And so just as a kind of kickoff, for those of you who may not be as familiar with the National Transportation Safety Board, or NTSB, I just wanted to dedicate a few slides to talking about who we are and what we do. So the National Transportation Safety Board, our mission is independently advancing transportation safety, and we do that mainly through our investigations of accidents. We launch teams of investigators out into the field where most people know us best for our aviation investigations, but we investigate all the modes. I'll have a slide about that in a moment. We send teams out to gather factual evidence about crashes or accidents, document that thoroughly, do as many kind of lab tests or other things that we need to understand, and ultimately issue comprehensive reports that detail those accidents and present them their probable cause of those and recommendations to present future such accidents to our board and to those recipients. So as I mentioned fleetingly, we are multimodal. We do have a mandated responsibility to investigate every civil aviation plane crash that happens in the United States. And although there are extremely few, thankfully, air carrier crashes nowadays, there still are over 1,000 small plane crashes or general aviation plane crashes that happen each year, and our investigators are responsible for investigating all of those. That is our mandate. In the other modes, rail, pipeline, highway, and marine, we do not investigate all of those crashes. In the marine, rail, and pipeline arena, we have thresholds for severity where we get involved, and in the case of Marine, a memorandum of understanding with the Coast Guard to share investigative duties with them. I work in our highway area, and we have a pretty unique latitude in our group. There are just so many highway crashes that happen each year, over 40,000 fatalities, that we couldn't possibly really capture any kind of census, even all fatal crashes. So we do tend to choose those crashes that are very high profile and that can allow us to either understand an issue better that we don't feel that we understand very well, or to promote safety issues that we think are particularly important. So we have 5 presidentially nominated and congressionally approved board members. Right now we have 4, as you can see. Chairman Robert Sumwalt, who has been a board member for many years, over 10 years at the NTSB, was just nominated and confirmed to be our chairman. We have a vacancy in the vice chairman slot, and then 3 other board members. 3 of our board members currently have aviation backgrounds, and member Bella Denzar, who many of you may be familiar with because of her public health background, is very knowledgeable in highway and several other areas. The purpose of these folks, all the work that we do as the National Transportation Safety Board staff, we must present to them. So sometimes I liken it to kind of presenting your doctoral dissertation. You have to do all your work and then take it to them, and we have these meetings, sunshine meetings that are open to the public, where we bring all the facts that we have of an investigation out, and we present them to this board with our conclusions and our proposed probable cause and recommendation, and it is subject to their discussion and questions for us and ultimate adoption of what we propose to them, and that is our basic process. The main product that the National Transportation Safety Board produces is our recommendations. We are not a regulatory agency. We really have no power to compel any of our recommendation recipients to do things that we want them to do. It's really, our focus is uniquely safety. Unlike our sister agency at the Department of Transportation, we do not have a competing motive of reducing traffic or congestion or commerce. We're 100% safety, and we're known for being kind of a safety watchdog group, or shining a light on safety and making recommendations to whomever we believe can make a difference to improve things. And so we have made recommendations to vehicle manufacturers, operators. We oftentimes make recommendations to our 2 regulatory agencies to do regulation, directly to states and local governments as needed, or really truly to whomever we think associations may be able to do it. We've made over 13,000 recommendations since our inception, and we have a very good track record of having our recommendations adopted successfully. Now, personally, I think that 82% is something to be proud of, but I should also mention that, in my mind, some of the most important and toughest recommendations that we've made over the years have not been implemented, and we continue to push for those recommendations through our most wanted list of transportation safety improvements. Every year for a while, and recently we changed to a 2-year list, we as an agency put out a list of the top 10 things that we believe needs attention, needs focus out there. And I'll show you our most wanted list for 2017 and 2018. And you can see reducing fatigue-related accidents is at the top of the list. And that is probably, perhaps along with substance-impaired operation, 2 of the most long-standing issues that have been on the NTSB Most Wanted list. In fact, I believe the Most Wanted list was conceived in 1990, and there maybe have only been 2 years out of its entire history that fatigue-related accidents haven't been on there in some shape or form. And I think that there's a good reason for that. It's because it's such a ubiquitous problem in transportation safety, and it's a very tough one to fix. We've made over 200 recommendations in this area over the years, and the acceptance rate for these, although still high, is considerably lower than our overall acceptance rate for our recommendations. And there are some that, I've been working on pretty much the whole time I've been at NTSB and continue to advocate for. So it's an area that's dear to me. I think it's an area that's very important to focus on, and that's what I'll be focusing on today. So the main focus of my talk today, as I was asked by Dr. Wong, was to talk about how we investigate human fatigue factors in crashes. And this is actually a topic for which the NTSB annually offers a 2-day course. So if anyone who is listening to this presentation today finds it particularly interesting, this kind of high-level survey view, and wants to come to Washington, D.C. and do more of a deep dive, we have a 2-day course. We're actually offering it in about 3 weeks, so it might be hard at the beginning of a fiscal year to jump in, but maybe next year some of you all can join us. We have presentations from our recorder specialists, from our medical doctors, from a board member. We oftentimes are able to have actual crew members from some of our investigations that we've had come and talk to us about their personal experiences during the events they were involved in, and participate in interview practices with us. And then we always have a scientist come and give kind of a fatigue 101, the kind of the state of the science in fatigue in general, and then this focus on the methodology of how we do our investigations, which is what I'm going to focus on today. So I just wanted to put that plug out there and let you all know that that's something that's out there. But today I'll be kind of talking about the heart of the watermelon of how we do the actual investigation part. So I'm going to show you a schematic now that there are two, I should click back here. So there are two big questions that we try to get to when we're doing these types of investigations. And it's actually quite simple. Was the operator fatigued? And did fatigue contribute to the event? So in some ways, those are two simple questions, but getting the answers to those questions can be pretty complicated, and that was why I worked with other staff members here to develop a methodology to answer these two questions. So I'll start with the first question, was the operator fatigued? And so this flow chart that you see here in front of you now are some of the types of things that we look at evidence-wise and some of the ways that we evaluate it to make that determination. So the one I'm going to focus on first, and what I consider to be probably the most important thing to look at in answering this, is the operator's sleep-wake history. So it's really about sleep. So much of fatigue and about drowsy operation and fatigue-related accidents gets back to sleep one way or the other. So one of our biggest challenges when we get the call to send a team out is to start to gather that information. Now, just a quick pause to say, we have to look at everything. NTSB, we launch out a multidisciplinary team, and we have, I'll just use highway as an example because that's where I work now. We send out somebody who's an expert in the vehicle, in all vehicles. We send out someone who's an expert in the roadway. We send out somebody who's an expert in occupant protection issues. We send out somebody who's an expert in motor carrier if we have a motor carrier. And then we send out an expert in human performance, and that's someone who's usually focusing on the driver and maybe focusing on other human players in the system who human factors may have contributed. And then within that human performance group, that person is looking at all different kinds of things you can think of, like illness and distraction and all the different kinds of things. So clearly I'm focusing on just kind of one narrow slice of this in the fatigue arena. So getting back to that, the types of things we look at, the first and most important thing is to look at that operator sleep-wake history. And how do we do that? So key evidence sources I've listed here, some of the most important things that we look at when we're trying to understand whether an operator was fatigued at the time of a crash. interviews with the operator, him or herself, interviews with witnesses, interviews with people who interacted with that person in the days leading to the event, and then schedules and logbooks, cell phone records, audio, video, and data recordings, and other time-stamped records. So I'm going through that kind of quickly just because I have some examples of each of these that, or at least most of these that I want to share with you. So first, talking about interviews. Interviews can be really, if you have a willing person talking to you, can be extremely valuable. There are some challenges with interviews. Sometimes the operator is deceased. Sometimes the operator is injured and can't speak. Sometimes the operator doesn't want to speak because he or she is concerned about any kinds of criminal repercussions. And that can be particularly true in a highway environment where sometimes we're working alongside law enforcement whose job is to find out if any laws are broken and if anyone needs to be prosecuted. So, but when we can interview operators, there are a lot of things that we try to gather from them. We try to get their sleep and wake times, both in recent days and also typically, because we know that individuals have different sleep needs. So sometimes finding out what a person does during their off time or their vacation time or when they don't have to set an alarm is important to compare to the recent sleep history. We basically try to just ask people to recount as best as they can the time and duration of all of the activities that they did leading up in the days leading up to the event. The kind of catchy phrase that sometimes people say is 72-hour history, and even here we say 72-hour history, and I think it's a little bit of a vestige of a time when that was the best that we could do. Nowadays, we'll go back a week or more just because sometimes we can, just to get a longer window of understanding a person's activity history and sleep-wake history, especially because we know that chronic partial sleep deprivation, so for example having one or fewer hours of sleep over a long period of time, can be just as detrimental as, for example, having one night of no sleep. We ask them about any drugs or alcohol, prescription or otherwise that they took, and times. That's just part of our total interview package. We have to, you only get one interview with the driver, and so you don't get your fatigue interview and your drug interview and all that. So you're usually trying to pack a lot of information into one interview. You want to get a sense of sleep quality, and then finally and importantly, subjective sleepiness. How were you feeling around the time of the crash? So, so this is just kind of an example of something that I had to learn as an investigator about different ways of asking questions. And those of you who have done interviews or survey research can probably see this, which is, you can ask somebody if they got enough sleep last night. Did you get enough sleep last night? And most people will say yes to that question. So that's probably not the most constructive way to ask that question. You could say, how much sleep did you get last night? And I actually made the error early on when I did some survey research of asking people this question. And it's amazing how many people will say 8 hours. It's just like, it's kind of a knee-jerk response. So what we typically do is we say things like, what time did you go to sleep last night? Or what time did you go to bed? What time did you go to sleep? What time did you wake up? What time was your alarm set for? Did you wake up before or after your alarm? We try to ask specific questions about when people did go to sleep and when they did wake up, so that we're not asking them to do the mental math. We're just asking them to recall as best as possible, and then we do the construction of that later to get a good understanding of it. So it's just a little bit in the weeds of interview tips. And other tips that we give in our interviewing class, or when we focus on this, is to know as much as you can before you start the interview. Sometimes you can't know anything, but if you can, it's always good to know. We always recommend using a recorder or a note taker so that when you can focus on that individual and be a really good listener and not have to focus on documenting everything. And then to consider filling in a grid or a log to document the schedule data. And I'll show you an example of some of these later. So, and ask for confirmation sources. That's always a great idea too. So work schedules. So work schedules are often the first piece of information that we have about a person's activity history. The picture that you see here is an example of a paper logbook that a truck driver might use to document his or her duty time, driving time, time that they're on duty and not driving, and time in a sleeper berth. And truck and bus drivers are required to fill these out. A lot of companies are moving to making these electronic, and there is a requirement that they will have to use electronic logging by the end of this year for many different types of operations. But in all types of transportation, at least, there's usually some type of a rostering system or a scheduling system where you can get basic information about people's on and off duty times, either on paper or electronically. There's good and bad things about this. It gives you kind of a quick snapshot of, whether a person was a shift worker or, whether they were working very long shifts. One of the challenges with these is historically they've been kind of notoriously incorrect, especially with paper log keeping. Sometimes drivers may have multiple sets of logbooks that they keep, one for the law enforcement that might pull them over to do a check, one for their employer, one for themselves. So, this is important information and we always try to get it, but it's just one piece of the puzzle. Another important bit of evidence that we routinely gather now is cell phone data and cell phone records. And that, there's a kind of a joke that I make sometimes is that cell phones are the new actigraph. And for those of you who are familiar with actigraphy, that's like a wristwatch that people wear that can say when a person is sleeping and when they're awake. And it seems like for many modern people, the cell phone is sometimes the first thing that you touch when you wake up in the morning and the last thing that you touch when you go to sleep at night. So they actually do end up being a very good way for us to look at a person's time that they're awake and active. So this is an example I'm going to show you. Cell phone data can be so very rich, and it can even scare people a little bit to know how much information that can be gleaned off of a cell phone. And we do try to be pretty respectful of people's privacy and not share information that's irrelevant to our investigations. But in terms of the types of information we can get is, you can know, of course, if someone is using a phone and it's them using the phone, they're probably not sleeping. But moreover, based on cell tower data, we can know things about a person's location to know if they were moving around while or driving using a cell phone. We can often get information about the content of text messaging or information about what types of uses they were doing with their cell phone, and we can get some of that from the phone itself if we secure it, and we can get a lot of it from records providers. So we typically, as soon as we're aware of a crash and as soon as we're aware of the driver and their cell phone number, we usually contact their service provider and put a hold on their records, and then we subpoena them and we're able to study them later. So this example that I'm showing you, you may be wondering, how is this cell phone data? This is a map. But what this is about a case I'm about to tell you about that happened in New York in 2011. And this is some cell phone records and cell tower data that we got from this driver. And this data that you're going to see here represents the day before the crash. So as I was telling you, interview data can be very useful, but in this case, interview data was not, even though we had voluminous interview data, it ended up not being particularly useful because this driver told us that he had gone home and was sleeping at his home between 11 a.m. and 4 p.m. But using the cell phone data, we were able to show, and hopefully you can see this, there's too much of a delay here with me clicking on this slide. Right now I just clicked and there should be a red line on your screen showing you that this is where we tracked his cell phone usage between 10 a.m. and noon that day. This is where we tracked it between noon and 2 p.m. that day. This is 2 to 4 p.m. And then there was a break, about almost a 3-hour break in usage, and then that was 7 to 9 p.m. So what we were able to learn in this case was that a good deal of the time that this driver told investigators that he was at his home sleeping, he was actually using his cell phone and driving a car around New York. And we were able to, another thing that we commonly are trying to do here is make sure that he didn't loan his cell phone to somebody. We need to establish that it was actually that individual using it. And in this case, we had witnesses who saw him at some of these different places that helped us to do that. So this is a picture of the crash that ultimately happened the next about 8 hours after all that cell phone data that you just saw took place. I'll just mention a little bit of detail about this crash, and then I'm going to use it a couple of more times to illustrate some different elements of investigation. This was one where I was the human performance investigator. It occurred, this motor coach was en route from a casino in Connecticut to New York City and was carrying 32 passengers. It occurred at 5:38 a.m. The motor coach drifted off the roadway, crossed the rumble strip on the 10-foot wide shoulder, struck a guardrail, and then overturned to the right 90 degrees. It flattened the guardrail as it continued to slide forward, and the front of the motor coach collided with a vertical signpost, as you can see, and it tore through nearly the entire length of the bus. As a result of this crash, 15 passengers were fatally injured, 17 passengers received serious to minor injuries, and the driver received minor injuries. And later on in my presentation, technology providing, I will show you a video, but not right now for the people. The probable cause of this crash was fatigue. So I want to talk about, I mentioned the driver interview. He had self-reported that he had about 7.5 hours of sleep on work days and about 13 to 16 hours on days off. So you recall that you'll routinely ask if somebody's off time, like when they're not working, what is your normal? And it was kind of a red flag, I will say, that any individual is telling you that they're sleeping 16 hours a day. I think that alone was something that was interesting to us in the early stages of this investigation. But as I mentioned before, when we looked closely at the known activities of this individual, there was a lot of information to us to suggest that he was sleeping very little. So I've given you a lot of information about the types of information that we collect and all the different sources. Now I want to show you how we put that together. So this is just a very small sample of what a master activity log would look like, but it gives you a sense of what we do. What I will do is take all of the information that I get from all of the different sources and get it into a common frame, and this takes work to make sure that different clocks are synchronized. You need to ensure that if you have a video camera in a casino, that clock is synchronized to a master clock, and that all of your other things are synchronized to a master clock. So you can see here just a snapshot from this particular crash I was talking about that shows, at 1:56 a.m. we have casino video that showed him in the bus arriving at the casino. Based on the driver interview, he said he was asleep at the bus 2 to 6, and so forth. All these different sources. And so what we're doing here is we're looking to see if we can reconstruct, and we're looking for inconsistencies and then trying to resolve those inconsistencies. And then once we do that, we can usually put it into a grid, and this is an example of the grid that we use. So this is the high level of example of the charts that we use, and in this one, the red bars that you see represent the 3 days before the accident and the morning of the accident. And the labels at the top represent the 24 hours in the day, starting with midnight, and each of those segments represent an hour of the day when he could have obtained sleep. So just to show you how this works, I'm going to drop out the times when the driver was operating the bus. So there's the times that the driver was operating the bus, and you can see those are the remaining times. And if I drop out the times when he was using his cell phone, you see that it gets even more constrained. And then Finally, another piece of data that we had in this crash was that this driver had rented a car and had the car itself, it was like a zip car, if you know what that is, like a car sharing service, had a telematics system on it that allowed us to know it was in use. So when we dropped off the times from the car sharing service, what we determined was that this particular driver had almost no opportunities to sleep during his daytime off-duty periods. So the only time that he was really having any opportunities for sleep was at the casino during the times when he was waiting for his passengers to come back. And that's what you can see, this circled area that I have on the slide here. Really, the only times that this individual was getting any opportunities for sleep was during these early morning hours on the bus at the casino when he was waiting for passengers to come, waiting for them to finish gambling. So that's a pretty extreme example. They're not all nearly that cut and dried, and I'll be giving some examples a little later that are a little fuzzier, where I can show you that it can be more difficult to make a determination. So just big picture, kind of, zooming back out again. What are the kinds of things that sleep-wake history can tell you? Well, it can tell you about acute and chronic sleep deprivation. If somebody hasn't had much sleep in the last 24 hours, that's important to us. Or, as I mentioned earlier, if you have a situation where somebody's sleeping maybe 5 or 6 hours a night over multiple nights, that can accumulate and also cause a problem. You can look, using the sleep-wake history, you can tell if the person has had recent schedule inversions, if they work rotating schedules, if they've had a jet lag situation with transiting to different time zones. And then you can look at time awake or time on task if they've been working for a long time without a break. Those are all the different kinds of things that can give you a hint about whether an individual was fatigued. So we kind of went through the operator's sleep-wake history. The next thing I'm going to talk about is health, and then using the sleep-wake history and the health history put together, that's what will really tell us whether an operator was fatigued, and then we'll move on to, did it make a difference? So looking at operator health. So first we need to look at their health history in total, and then determine whether any kind of health history may have had an impact on their daytime alertness or nighttime ability to sleep, or sleep time ability to sleep. So what can health-related evidence tell you? One of the big common things that we're looking for, or that we hear about in the news, is sleep disorders or sleep disorder risk factors, with obstructive sleep apnea and insomnia probably being the two most prevalent sleep disorders that we've come across in our work, and most prevalent sleep disorders in general. Restless leg syndrome is another that can come up once in a while. We're also just looking at everything. We're looking at anything that could potentially affect alertness. So just to give you two examples that I'm familiar with that we have had in our history, is we've had one case where a person had gastroesophageal reflux disease, or nighttime reflux, where they couldn't get sleep because of that. And we've also had people involved in our crashes who have had chronic pain that has interfered with their sleep. So those are just two examples of things that you might not traditionally associate with sleep, like a sleep disorder, like you would with a sleep disorder, but that can really make a big difference in terms of a person being able to have good sleep quality. And so we're looking at all of that. And then, of course, we're looking for the presence of sedating drugs or alcohol and other drugs. And so why? Diseases and drugs, we're interested in them because they can cause you to be sleepy, they can impair your sleep, or they can have interactive effects with sleep deprivation. So there's all these different types of ways that they can make an impact. So the key evidence sources I have are toxicology analyses, of course, interviews, any medical examiner records, personal physician records. So I make this distinction between medical examiner records and personal physician records because it's an important distinction because, if you can imagine, people who are trying to get employed and go through medical examinations to get employed don't always tell that company doctor all the things that they tell their personal physician. So we always try to work to get both sets of records so that we can have a full picture of it. And pharmacy records, our folks are kind of known to draw a big circle around where people work and around where people live, or our operators live, and just visit pharmacies and put in subpoenas to get a good understanding of what kinds of substances that person may have been using. I'll talk about a case that possibly many of you heard of. It was very highly publicized. This was a train derailment that happened in 2013 at about 7:19 a.m. A southbound Metro North passenger train derailed on track number 2. It was originating in Poughkeepsie with a destination of Grand Central Station. There were 7 passenger cars and 1 locomotive at the rear that was pushing the train. As a result of the derailment, 4 passengers died and 59 people were transported for injuries. In this case, the estimated train speed was 82 miles per hour at the curve, even though the posted speed was 30 miles per hour. So pretty much as soon as the crash occurred, we knew that that was a problem we needed to understand better. Our investigators ruled out any problems with the signals and the train brakes and the tracks. So, they were pretty quickly able to rule out some of the common types of mechanical issues that might have led to this type of a crash. We learned that the operator had somewhat recently undergone a schedule change from the beginning in the late afternoon to beginning at 6 a.m. So it was a bit of a backward rotation in the schedule, but it wasn't too recent. But the more important information was discovered when we were looking at his medical records. So as I mentioned, the difference between the medical examiner and the personal physician, when we looked at his medical records from the medical examiner, he had passed all of his required physical exams. In railroad, actually, currently there are very few requirements. Federal Railroad Administration regulations only call for vision and hearing testing. And so all of his required physical exams checked out. But when we looked at his personal physician records, we saw that he had put in complaints of feeling daytime fatigue that his personal physician had noted, his obesity, he had hypothyroidism and low testosterone, but that no additional follow-up tests had been done on that individual. The engineer's wife reported to investigators that he snored regularly, so he was asked if he would undergo a sleep study, and did, and was diagnosed with severe obstructive sleep apnea. So after the crash, once he was diagnosed, he was treated and was really being treated effectively within 30 days of that. So it was really a missed opportunity. It's something that we have highlighted in our recommendations. We have pushed and continue to push for the Federal Railroad Administration to have obstructive sleep apnea screening as part of its medical exam, like they do in aviation, for example, and to some degree in highway. So that's an example. And there have been actually several other high-profile sleep apnea crashes in the rail industry in the last 5 years. And Metro North in particular, I know, has done quite a job of going back and testing its workforce for sleep apnea, and found that over 10% of its population did have moderate or severe sleep apnea. So it certainly is a problem, and that's one example of how we found it. So toxicology is something that is very valuable, can be hard to get. This is the post-crash toxicology data that is sometimes required to give blood and urine samples, DOT. There's a regulation for a DOT urine sample after a fatal crash. We sometimes get it, we sometimes don't. It can be very helpful when we can get it, and it requires expertise to interpret. I will talk about a case that happened in Chesterfield, New Jersey in July 23rd, 2013 to illustrate how toxicology data was useful to us in understanding this crash. I do have a video to go along with this that perhaps we can play right now. It'll just give you a better sense of the dynamics of this crash. That school bus picture that you can see in touching that post is kind of the end of it, but it's hard to kind of describe the dynamics of this. So if my facilitators can pull the Chesterfield video in now and run that, that would be helpful. But if not, I can just carry on and describe the crash. So there may be a little bit of oddity with the timing, but I'll just narrate a little and say that a school bus was transporting about 25 students to Chesterfield Elementary School. And in this case, there was an intersection, and a Mack roll-off truck with a fully loaded dump container was traveling east on Highway 528, approaching the intersection. The bus driver had stopped at a flashing red traffic beacon and stop sign, and as the bus pulled away from the white stop line and entered the intersection, it failed to yield to the truck and was struck behind the left rear axle. The bus rotated nearly 180 degrees and subsequently struck a traffic beacon support pole. 1 bus passenger was killed, 5 bus passengers sustained serious injuries, and 10 passengers and the bus driver received minor injuries, and 9 passengers and the truck driver were uninjured. So in this case, I'm going to be focusing on the bus driver. Basically, the investigation determined that the bus driver, although he claimed he looked both ways, did not see the oncoming dump truck and pulled into the intersection. And we looked closely at his history. And in this case, the driver's health records, we learned that he had routinely gotten about 5 hours of sleep per night, and that he had some health issues, including a history of back pain, hip pain, and leg pain. And in addition to those issues, he did have a history of alcohol abuse, and he did self-report to investigators that he routinely drank 2 double drinks each night before bed. Now, that alcohol use is of interest. You know, alcohol abuse, of course, we don't want our school bus drivers having alcohol use. Although he wasn't doing it before he went on shift, it's important in the sense of drowsy driving, because we know that although a small amount of alcohol may induce you to fall asleep, depending on the amount you have, it can cause nighttime awakening. So that was something of issue. And then finally, in the toxicology, there were at least 3 drugs that the driver had in his system that were associated with daytime sleepiness. So in this case, we did conclude that the school bus driver was fatigued due not only to his sleep loss in the night before the crash, but chronic sleep debt and poor sleep quality associated with both his medical conditions and alcohol use, and the sedative side effects from his prescription medications and the potential synergistic effects of those. So there was a lot of different bits of evidence that together kind of made this total picture of how he may have been influenced by fatigue. So the last bit of evidence that I wanted to mention that I think is kind of interesting and something we have not looked at in many cases, but I think it's kind of an interesting one to call out, which is if when we do learn that an operator has obstructive sleep apnea, oftentimes they may have been diagnosed with a continuous positive airway pressure device, or CPAP device. I only know of this being used once or twice in our investigations, but I wanted to mention it because I think it's kind of interesting. In this case, we had a plane crash, a general aviation plane crash, a Cirrus 22, that was 4 fatal. So we had a pilot that had passed away, and we found out on his medical certificate that he had documented obstructive sleep apnea. So one of the bits of data that we were able to gather was a data card from his CPAP device that helped us to understand that he was using it. So that was, you know, I guess my point here is that it's kind of interesting that sometimes some of these could not only help us to say somebody was fatigued, but potentially help us to rule out or document that they were sleeping or using such devices. So that's the end of the health section, and I don't have a picture of my my schematic again, but I'll mention that you take basically once you have the health data and you have the sleep-wake data, you put that together to answer the question of, was fatigue a factor? Was this operator fatigued at the time of the crash? And then assuming that the answer is yes, then you go on to the next question, the next schematic, and that is, did fatigue contribute to the event? So you've gone halfway through, you say, you know, I have the kind of information that I need to determine that this person was likely affected by fatigue at the time of the event. Then the next important question is, did it contribute to the event? Now, I just would like to kind of pause here and say, well, what if it didn't? Is it still important? And my answer to that is yes, it is still important, because once you've determined that there is a system where an operator was fatigued at the time of an event, that alone may be enough for you to look deeper at the kinds of problems that are associated with that. But, you know, in our world, we need to say, what was the cause of this crash? So did it contribute to the event? That's when we start looking at performance factors. And there are a variety of different things that we can do to look at performance. We can use recorders. I'm dating myself. You know, I've been working at this agency for 17 years. 17 years ago, it was only airplanes really that had recorders. Nowadays, almost every vehicle that transits the earth has some kind of recorder in it, it seems. We can use self-report, we can use interviews, and we can use wreckage. And so that's a picture of somebody pulling a black box off of a train. So once we get that information about their performance, we want to relate it and see if it's related to known fatigue effects. And this image shows some results from a study that was done using a reaction time test known as the psychomotor vigilance task, where they have people who have to do a very boring task where they watch a screen, and when they see a certain stimulus, they have to respond. And the top part of the slide shows when you're not sleep deprived, you can perform this task almost flawlessly. But when you're very sleep deprived, it shows that people have delayed reaction times, or that sometimes they haven't just elapsed where they completely miss it. So those are the types of errors that we see most commonly with sleep deprivation are those types of errors. So delayed reaction time, overlooking or skipping tasks, impaired decision making, tunnel vision or cognitive tunneling, where you're not adapting to new information in your environment, and reduced short-term memory. Those are all things that the literature has supported in more experimental environments being associated with sleep deprivation. And so we'll be looking at the types of performance errors that an operator may have made and trying to see if they map on or are consistent with that. And so here, this list is some of the kind of typical actual observed things that you might see. So slow reaction time, not steering away from an obstacle, visual fixation, procedural errors, and then ultimately potentially in microsleep. So let's play, if we can, if it's easy enough, the video, I guess it's labeled Highway 11, the New York video, and you'll just get a sense. In that case, we had passengers on that bus who were reporting to us that the driver of the bus had multiple lane excursions over the rumble strips prior to the crash, and then ultimately had a shallow angle of departure off the roadway without any correction, no braking, and then, of course, the crash occurred. So sometimes it's the absence of what you would expect a normal operator to do is the biggest indicator of fatigue. When you have, great, thanks. So we can go back to the slides now. And I have another example that I'll mention just wanted to touch on another mode quickly. I have the Titan sinking. This was a crab fishing vessel that sunk on December 5th, 2014. I thought this was kind of an interesting one. This was a first fishing trip. It was a crab derby where fishers go out for multiple days and try to just get as many crabs as possible. And in this case, they were on their fourth night, and the rest of the crew was sleeping below deck, and the captain took control of the vessel. he activated the autopilot, but he did not set the watch alarm, which would have been a very easy thing that that captain could have done, which would have activated a sound and a light after inaction from him after a certain time. So it could have been a very helpful thing, but for some reason, possibly because he was very tired, he didn't think to set it. We know that the boat failed to turn into a channel. There we go, a failure to do a known activity. And then a nearby boat tried to contact them and radioed and had no response. And then ultimately they hit the jetty, sank at about 2:15 a.m. And thankfully the crew was rescued, but the crab was lost. And there was an environmental damage and fuel release. And this captain later reported that even though he had had a 2-hour nap right before coming on duty, he couldn't recall any specific sleep periods during the 4-day trip apart from occasional naps. So he was extremely acutely sleep deprived, and then not only had errors but failed to set a system that could have served to help him to stay alert. So did fatigue contribute to the event? So we talked about the types of evidence that we're using to document performance. We're talking about how we compare it to what we know about fatigue. And then the final one that I want to talk about is considering alternative explanations, because there are other reasons why you might not do something or that you might have an error besides fatigue. And so we always have to consider what can an alternative explanation be. And for that, I will use the Clarence Center, New York example, also that happened in 2009. And this was really one of our most recent major plane crashes in our history. This happened. This plane was on instrument approach to the Buffalo airport and crashed into a residence in Clarence Center, New York. The 2 pilots, 2 flight attendants, and 45 passengers on board were killed, and as was 1 person on the ground, and the airplane was destroyed. This one, for those you may know, led to a lot of interest in fatigue because the pilots who were flying this were commuting from their homes by air, so they were traveling long distance. For example, the captain was commuting from Tampa, Florida to Newark to take his work shifts, and we also knew that the co-pilot during an off-duty period had elected to go on fly standby on a trip and not do much sleeping during that time. And ultimately, in this particular crash, the board did decide that the pilot and co-pilot were experiencing fatigue at the time of the crash, and the actual conclusion was that the pilot's performance was likely impaired because of fatigue, but the extent of their impairment and the degree to which it contributed to the performance deficiencies that occurred during the flight cannot be conclusively determined. So in this case, there were other competing factors having to do particularly with the pilot's performance in the past in similar situations, and some of the other practices that they were doing in the cockpit that indicated that, number one, that they were pretty alert and talkative and during the last stages of the flight, but that they were doing other performance things that may have led to the errors that they committed. So this was a case that actually led to a lot of changes in the aviation industry that dealt with fatigue, even though the NTSB didn't come forward and say that it was part of the cause. So I guess I just wanted to make that point, that it's not always part of the cause. So I'm running a little short on time, but I think I'll be able to cover the remainder of my slides. The last bit I wanted to talk about was just about, what next? What are some of the other things that we look at? We may have determined that, fatigue was part of the probable cause, but just knowing that sometimes isn't enough. We want to look deeper, and we want to understand what is the root cause? What are some of the issues in the system that may have given rise to that situation? So that's where we try to do our best to document the entire work system and the entire organizational system in which that was taking place in. So some of the key evidence sources that we routinely document are company policies and training materials. We do interviews with other people who this is, for example, in a commercial operation, other people who may have worked for the company, dispatchers, customers, to try to understand the whole system that they were working in, especially if there were things having to do with scheduling and things we need to understand better. And then direct observation of the work environment that might involve if it's an extremely cold or hot or dark or high workload environment, to try to understand all of those types of issues as well. So my final example that I want to talk about today was a crash that took place in Cleveland, Ohio on February 18th, 2007 that I think illustrates some of these issues with potential environmental factors and how they can influence things. So this was a crash that occurred. It was operated by Shuttle America, and it was an overrun of the runway when they were landing at Cleveland Hopkins Airport during snowy conditions. Fortunately, all of the passengers, all 71 passengers and 4 crew members survived and walked away. So it was just really just damage to the airplane. But we still investigated it because of our mandate. The captain in this aviation crash was a 31-year-old male. He had complained to his personal physician about chronic cough and insomnia, which he had developed over several months. So the physician had treated the cough with medicine but did not treat the insomnia and said that he might refer the captain to a sleep clinic. So this crash occurred about 5 months after that, before he had returned for further treatment. This captain had a history of insomnia, and he had volunteered for this trip, but then after taking this multi-day trip, the night before this particular crash, he had a bout of insomnia and had only had 1 hour of sleep. So that in itself, of course, is interesting and very likely had something to do with this particular crash. He reported for duty at 5:25 in the morning and had been awake for 31 out of 32 of the preceding hours. So there we kind of have our cause. But then digging deeper, there were some interesting things about this case. So this, we learned he had a heavy flying schedule. So he had flown, at the time of the accident, he had flown the maximum 30 hours allowed by FAA for a 7-day period. And the accident was the last flight of the day and was a kind of at the afternoon postprandial dip of circadian alertness. So, but more interestingly, there were some things going on at the company. So the company, Shuttle America, had an attendance policy that allowed pilots to remove themselves from duty due to fatigue. But contrary to that policy, the company had recently sent a warning letter to about 19% of its pilots, warning them that any further absences, so people who had a significant number of absences in their past, that if they had any further absences, that it would be cause for termination. And this captain had received that letter. So, he was concerned that if he had self-reported fatigue before this trip, that he might be terminated. And so this was something that we made a point of calling out in this particular investigative report, and noted that part of the issue was Shuttle America's failure to administer an attendance policy that permitted flight crew members to call in fatigued without fear of reprisals, which is really an important part of a fatigue risk management system. And I think that this particular crash illustrates how badly it can go wrong if you don't have a policy that lets people to elect out of working when they're unsafe to work without fear of reprisal. So just to wrap things up, I wanted to have kind of some takeaway messages in terms of investigating fatigue factors that I think are kind of the big take-home messages. And if you ever find yourselves investigating a fatigue-related, but possible fatigue-related crash, sleep or lack thereof is key, and one of the most important things to document the best you can. You want to gather perishable evidence first, talking to people, getting toxicology samples. Some of these things, there's this very short window of time when you can get good information after a crash, and you want to get that first, and that's the kind of thing that people learn in some of our other types of training classes that we do at NTSB about, where you need to direct your attention. Using multiple sources of evidence whenever possible. You really, as some of the cases that I gave you today illustrate, sometimes the evidence that you gather is not necessarily going to agree with each other, and so that's why it's important to look at multiple sources and try to determine what is the best possible information. And then lastly, as I mentioned, particularly with the Clarence Center Colgan Air case, operator fatigue that's not causal may still be very important for safety and looking at the safety of the system and looking for improvements that can be made.
So that concludes our webinar today. We would like to thank Jana for her time and to all the attendees for their participation. We look forward to your participation at our next Working Hours Sleep and Fatigue webinar, and I hope everyone has a great afternoon. Thank you. The findings and conclusions in this presentation have not been formally disseminated by the National Institute for Occupational Safety and Health and should not be construed to represent any agency determination or policy.